I finished medical school and I did not know what kind of doctor I wanted to be, but since then I've been a GP in this country, in America and in South Africa, and I found that being a GP and looking after patients is very similar all around the world. Patients have the same problems, the same concerns. We have slightly different drugs and different technologies in different countries, but patient care and primary care is the same all around the world. And to me, it's the attraction of a job where you could really travel anywhere around the world and still be a primary care doctor. The main thrust of my research is helping parents and GPs identify which children might have a serious illness when they bring their child in to see their doctor. Probably the most important thing that most parents would want when their child is sick is to know that their doctor can pick up when their child's got something really serious going on, something that really needs to be diagnosed and treated right then and there. And unfortunately in primary care we don't have great evidence or research to help GPs and parents make those decisions. So for example, we've been looking at how children with meningitis present in primary care. So most parents know that symptoms like a rash is very common in children with meningitis, but unfortunately that doesn't happen in the very first few hours of the illness, only by the time the child ends up in hospital. So what we've been looking at is what are the earliest features that could help parents and doctors help distinguish that child with meningitis from one who's just got a minor or self-limiting virus. And some of the very earliest features occurring hours before the rash are things like very cold hands and feet, the child looking very pale, or having very severe leg pain or arm pain. And these red flags or early warning symptoms could help pick children with meningitis up many hours before the rash occurs. We're now looking at other illnesses that present in primary care, like cancer, diabetes, serious bone and joint disorders, to see if we can use the same kinds of methods to help pick up those children with serious illnesses earlier.